Hello, I am Dr. Vani Kulhalli, Senior Consultant Psychiatrist at Amaha. I have 20 years professional experience in psychiatry. Research has now proved that separation of mind from body is an outdated concept. Brain is connected to every part of the body through the nervous system. Our nervous system receives input and most of this input is processed in the brain, which then gives output for appropriate response from that particular part of the body or organ. Thus, mental and physical health are intimately interconnected in a bidirectional way. When severe illnesses cause fear and instability, patients who receive counseling support and treatment for their mental illness are able to handle their emotions better. Mental health interventions restore life functions like sleep, appetite and energy levels so that the patient can focus on recovery from their disease. At a deeper level, mental health interventions also help to restore patients' immunity and metabolism to optimum functioning, and that also helps in their recovery. People with mental illness who are on medications for a long time are prone to develop certain medical conditions. When taking psychiatric medications under regular supervision of a psychiatrist, psychotropic medications are very safe in every type of medical condition. In fact, they improve outcome of medical condition by stabilizing the patient's emotions as well as by helping to balance the metabolic and immune responses. So, psychotropic medications are very safe in medical illnesses.